So I'm an orthopedic surgeon, and as part of my training in orthopedic surgery, I've done plenty of spine surgery, very familiar with the anatomy of the spine. And while it's not my area of specialty, it's something I know enough about to know what the issues can be. And I came across Fix Your Own Back after a long journey of trying to figure out what was wrong with my back and why, no matter how much PT I did or injections or any other treatments that exist out there, I was still struggling with getting my back to a place where it would let me function consistently in life. And so I really wanted to try and find solutions that weren't so obvious, and from another physician who specializes in the spine recommended you, and I came across the site. And one of the first things you ever told me, which made a lot of sense at the time and in retrospect has proven to be true, is that a lot of people have the ingredients to the cake, but they don't have the recipe. And so you can know all the core stabilization exercises, but if you're not doing them in the right order, with the right reasoning why, and understanding the cause behind it and then the treatment forward, you can fail. And I think that's where I was at, which is where I was doing a lot of the things that people say to do, but I wasn't doing them in the right way or the right order or the right time or for the right reasons. And so that's what led me to this program that has very much helped me. I did consider surgery for my back, and having done plenty of spine surgery and training, I know I didn't want surgery, and I'd say that most spine surgeons would tell you not to have surgery unless you absolutely need to have surgery. Being in my profession, I was lucky enough to have meet with surgeons who were very thoughtful about my back and were able to give me honest recommendations, which included, for your back, try and avoid surgery if you can. We can do surgery, but it's not a guarantee to make you better. What I was looking at would have likely been a fusion, which I know at my age is going to lead to more problems down the line eventually. And so I really wanted to try and avoid a fusion if I could. To me, I wanted to really leave no stone unturned before saying, hey, I really need surgery. And I still feel that way today. My diagnosis was a degenerative L5-S1 disc. When you look at it, and I've looked at plenty of, lumbar MRIs in my life, the pathology didn't quite match the symptoms, meaning that the symptoms were worse than what the MRI looked. I have some issues there, but I had a hard time explaining why this was causing me so much dysfunction. Yeah, so I am fortunate to have connections, people to talk to, especially in this world. And so, I had non-surgical spine specialists who did injections for me and really evaluated my studies. I had spine surgeons take a look. I had physical therapists work with me. And where it dead-ended, really was sort of that no one could really say with any certainty what could fix me. And, surgery was not necessarily a fix. It might be something that happens in the future, but it's not, most of the surgeons were saying, hey, this might not be a fix. And it may be, but it might not be. And I was still just kind of going through the ups and downs of with my back. And so that's where I started looking at alternative solutions, and that's what led me here. Yeah, I think it's been about a year, I want to say, since I've been working through with you and with the Fix Your Own Back program. And overall, I just say a general improvement in quality of life. My ability to play with my kids, my ability to work, my ability to exercise has all improved. Is my back perfect? No. We've talked a lot about, and you've talked a lot about how when you have back pathology, There are going to be times where things can flare up, and that certainly still is the case for me today. But overall, I'm not as worried about my back. I don't think about my back every second of the day like I had been before, which comes a lot of peace of mind and also just ability to enjoy life.